As with any therapeutic modality, there exists some form of misconception around the effects of the technique, and K-tape has its fair few. In this video, we will help clear up some of the confusion around K-tape. The first of which is the possibility that K-tape provides only a placebo effect. Not only is there evidence that kinesiology tape is effective, but there are also several studies that have shown that its effectiveness is not just a placebo. As we have tried to demonstrate within the research review, the clinical research is varied and lacking in some areas. However, there also exists a strong body of anecdotal evidence from therapists and patients which cannot be fully discredited or dismissed. The direction of application has also been said to have a specific effect. Kenzo Kaze, who is the creator of kinesio tape, argues that muscles are facilitated when the tape is applied from the origin to the insertion and are inhibited when the direction is from the insertion to the origin. Numerous studies have discredited this claim. As always, use your own clinical reasoning to decide the length, tension, and direction of application. Another misconception is that the tape will magically take all of your aches and pains away, and unfortunately this is not the case, as kinesio tape is not a miracle cure, it is not a silver bullet. As with any modality, some people may find benefit from it, and some people may not. A final misconception then was that of the kinesio tape colour having a therapeutic benefit, and we have covered this misconception in its own entirety in a separate video. In this clip, we will show you how to prepare an eye strip and round the edges of the tape. This here is a pre-prepared eye strip, and you can see the corners are nicely rounded, and this aids in the longevity of the tape and stops it from catching on clothing. To prepare the tape, trim it to the desired length for whatever technique you are carrying out. Fold the tape in half like so, and with your scissors, you will round both sides of the tape at the same time, like so. In this video, we are going to show you how to create a Y strap. This here is a pre-prepared Y strap. It's called a Y strap because we can split it in half like so. It is useful for such techniques as plantar fasciitis and wrapping around joints. We create the Y strap by cutting the desired length for the technique that we want to use. For the anchor point, we will round the edges of the tape at one end, then we will cut the tape in half like so, leaving enough space at the top for an anchor point, and then we will round both Y strand ends like so. In this technique, we are going to demonstrate to you how to prepare a limb fan. This is a pre-prepared limb fan. As you can see, we have quartered the tape to make these thin strands, each one being rounded at the corners with a solid anchor at the top, again with the corners rounded. This tape will be primarily used in techniques where bruising has occurred. To prepare a limb fan, first round the edges of the anchor piece at the top of the tape, like so. Fold the tape back in itself, noting to leave a sizable area for the anchor, and then trim along the midline of the tape. With the piece that you still have a hold of, again trim up the middle of that to produce two of the smaller strands. Then with the final piece, fold again back in itself and trim up the halfway line. We will then round each strand to take away any corners of the tape. and that is the preparation of a limb fan. In this clip, we are going to show you how to prepare one of the extra wide strips. The extra wide strips are used for techniques such as lumbosacral pain and sacroiliac joint pain. This is a pre-prepared piece. As you can see, the corners are nicely rounded. Cut the tape to the desired length depending on the technique you want. Fold the tape in half like so and round both edges of the tape. This will aid in the longevity of the tape and stop it from catching on clothing and skin. In this video, we will cover considerations that have to be made before applying K-tape. Within your case history, it is prudent to ask the patient if they have any specific skin allergies or if they are allergic to any tapes or glues, as this would be a contraindication to using an adhesive-based K-tape. Before applying the tape, you need to make sure that the skin of the patient is well prepared. This means that the patient does not apply any oils or moisturisers that will make the skin greasy, as this will affect the adhesive properties of the tape, preventing it from sticking and will produce an undesirable result with the tape coming off prematurely. You can use a pre-tape adhesive spray to reinforce the tape for a longer lasting application. However, the negative use of pre-tape spray is that this may increase the chance of irritation to the patient's skin. Care must be taken when applying K-tape to the patient that you do not overly restrict any movement by applying too much stretch on the tape. Also, common sense would dictate that you do not apply the tape overly stretched with restriction over main arteries or veins and also crossing the midline of the patient's throat. When applying tape, please make sure that you follow the guidance in the videos surrounding anchor points, as the anchor points are there to add stability and longevity to the tape.